Welcome to this episode of Hope Ropes. Today, I am so excited to introduce you to our incredible guest. This is Bianca Miret, a board-certified chiropractic neurologist serving the Tampa and Sarasota, Florida area now. She is part of the Carolina Functional Neurology Centre team, and they prioritize individualized care and root cause healing. And what I really love about her is her passion for the brain and nervous system, how she weaves it into her work. As she functions as a chiropractic neurologist, really highlighting how important the nervous system is in this work. Welcome, Bianca.
Thank you.
Oh, you're welcome. Well, I'm really looking forward to this conversation because as we've talked before we started recording, there's a lot of fear and lack of trust in the conventional medicine and doctors, even functional medicine in this community. So my personal experience, and I'm sure the experience of many of us have been burned, right? And we've had maybe some medical trauma, maybe we've been gaslit, or we've invested our savings or expenses in protocols that didn't help. And I know that that's not a one size fits all. I know we cannot paint all of our practitioners with the same brush, but I was hoping by having you on here that we could really understand how and see evidence of other practitioners, doctors who are doing things differently and are highlighting the importance of nervous system, neuroplasticity, and a mind-body approach to healing. And that's exactly what I want us to talk about today. So let's begin. Tell us how you got into this work and how your approach maybe is different from a typical chiropractor.
Yeah. I would say I've had a lot of exposure, and this has probably been more subconscious than actually the forefront of my brain, but a lot of family members that have chronic illness, family with degenerative neurological conditions. So I think, like, to some degree, this was something that I was exposed to quite young, and it
Mm.
probably, infiltrated my brain that way. I went to school at York University and I received a bachelor's of science and a specialized honors in kinesiology and health science. And from there, did an honors thesis in clinical neuroscience through that. So the human body has been something that I've always taken to, I've always learned very quickly on. It's so easy for my brain to pick it up. I love learning about it and its complexity in itself and how nothing, and this is my favorite saying, is nothing's in a vacuum in the body. Nothing's works in a silo. Everything's connected. And so I love learning about those connections and understanding. So that's something I grasped very young and through college. And then what I learned quickly was I don't necessarily want to be on the research front of things. Like, I like research.
Mm.
I'd love to contribute to it at some point, but I really like being with people. I really like being in front of a patient and listening to a story, and almost like a private investigator. You're like the PI of their body. You're helping them navigate. And so that took me to wanting to be a clinician. I would say through my upbringing, never against medicine, just the first line of defense, maybe not have taken to that. I wasn't a frequent flyer in the doctor's office. I always took supplements, small things that kind of shaped your experiences. And so I didn't necessarily want to prescribe and I didn't necessarily want to perform surgeries. And so I actually kind of fell into the chiropractic setting. And I remember not quite understanding much about it and shadowing and learning from providers in the field. And I remember my first experience, this chiropractor saw a 10-day-old baby and a 90-year-old man in the same morning shift, or what do you want to call it. And everyone was excited to be there. It was so interesting. I was like, what is this? And so anyway, through research and more experiences, that's what got me into chiropractic. But one of my big loves was learning about the brain, honors thesis, and just I always loved those classes at York. It fit quite well, but I wanted to learn more. So then through chiropractic school, I actually jumped into another program through the Carrick Institute, which is functional neurology. And so that is taking the bounds of clinical neuroscience and what research tells us about the brain and pathways. And then we're putting it into a clinical picture. We're then designing rehab based on what we understand about clinical neuroscience and really extrapolating that and putting it into, again, a patient. So I did that simultaneously through chiropractic school, and then graduated with my doctorate in chiropractic. Then shortly after, got my additional board certification in chiropractic neurology and functional neurology, and I've been practicing that way ever since.
Wow. That's awesome. So tell us more, because now I'm really fascinated about functional neurology. And so what does that look like? Let's just even give people a glimpse into how you would approach someone. Say someone comes into your clinic with one of the billions of symptoms like chronic fatigue, vestibular disorders, chronic pain, dysautonomia, long COVID. And what would that look like? Say I came to your clinic with my 100 symptoms and my long list of diagnoses. How would you approach this differently than if I were just walking into a doctor's office or a typical chiropractor office?
So I'll start with the chiropractor. So a typical chiropractor, and again, there's so many specialties within the chiropractic field. So I'm going to just talk very generally. But if someone's just coming out of school from as a chiropractic standpoint, they're looking at you holistically, but their form of treatment is typically the adjustment, which we may know as like the racket crack or the high velocity, low amplitude adjustment, or there's some people who do softer adjustments. Either way, that premise is based on we are moving joints, and we can do joints all over the body, but specifically the spine. And we influence the nervous system through what we call proprioception, which is information from the joints when we move them. We give input to the brain. It does create neuroplastic changes through those pathways, and then obviously helps to support the brain function. And it ultimately, and this is kind of where maybe people don't know what chiropractors do, but the brain is the master control center of everything. It does get affected by obviously metabolic conditions, but it goes both ways. Again, nothing works in that silo. The brain has impact on metabolics and vice versa. So traditional chiropractors are working on that one side where we affect the nervous system to have the downstream effect on the body. Where we come in is, yes, we do perform adjustments if needed and if warranted. So that's a big one. And I can kind of dive into that in a second, but we also perform neurological rehabilitation in our office. And so where we start with someone is we do a very in-depth neurological exam. So this differs from a medical neurological exam where we're doing a lot more testing off the bat. And then the way we extrapolate that data is different. So traditional medical neurology approach is to rule out any pathologies, any bleeds, any tumors, any pathologies that would be causing pressure on a nerve or in the brain, whatever it is. Yes, we are running those tests. If someone has something that comes up on an exam that is pointing to that, we're going to be having a very different conversation. But if that's not the case, we're looking at someone in this grayscale, like how well is their brain actually performing these tests? So as an example that I tell my patients is when we're doing an in-depth, let's say an eye movement exam, which we do in person, we do at bedside, and we use technology in our office to complete as well. So we take a look at it twice during our exam. I'm not just looking at, can your eyes move to the right? And yet if they can't, that indicates something very different versus, and again, that's a different conversation, but then how well, how accurate, how many steps did it take? Did your heart rate change when you did that? Did you overcorrect? Did you actually land on the target? Like these are all then the gray, and we know the pathways that control your eyes, Vanessa, looking to the right. We know all the pathways and the areas of your brain that are involved in that one basic movement. As you said, a vestibular case or someone who has a vestibular disorder or a vestibular issue, or they're dizzy, they may not know why. It's very complicated in that system, but there's a lot of communication from the peripheral apparatus or the inner ear that we think of as when we talk about the vestibular system. There's a lot of communication that goes from that system into the brain and how it integrates with other parts of the brain, your autonomic function, the area of migraines, like all these things that all integrates. And we have to evaluate not only how is the peripheral structure doing, but then how is the pathways communicating? How is the rest of the brain adapting? Why is this person feeling their symptoms? So we figure that out. Then I think the fun starts. This is when we can take different types of rehab and everything we do in-house is to create neuroplasticity. So the brain's amazing ability to change. The brain needs certain circumstances for it to change and to change correctly. So I always tell my patients, like, practice does not make perfect, practice makes perfect. And the brain learns every single moment of the day. So we want to make sure that when we're talking about neurological rehabilitation, we are getting as specific as possible to that person's brain. And we're looking at other components to make sure that the brain is being put in the best possible position to learn it, to adopt it, and obviously then to create more pathways and communications and strengthen that plasticity to take hold, and obviously resolving symptoms and things of that nature. So rehab can look very different per case, where it could be vestibular rehabilitation, along with some other things like eye movement therapies, adjustments, maybe autonomic retraining if someone's coming in with those types of complaints. It really just depends on why. And that's the
Mm.
big thing, is why. In our clinics, we also do offer functional medicine services. So like I said, some people operate under the premise of the brain just gets hit with the metabolic issues and the brain is just basically sideswept in that. Yes and no. The brain gets impacted by metabolic issues. It also has a hand in metabolic issues. So that's where we want to look at one with the other. And
Mhm.
again, if that's through us, like, we can handle that within our scope and our practice, great. If not, I'm getting you in front of an individual that can help us with that. If someone has diabetes, or if someone has a mitochondrial dysfunction, if someone needs to regulate their blood sugar, if someone needs to regulate their sleep, why is that? And how can we help the brain itself and the nervous system? And how can we help the metabolic system commingle and put the brain in the best possible position to change?
Awesome. So what I'm seeing is it's again very individual, right? Individual, holistic approach, because there isn't just one way to do this. And I think that's what the messaging I try and share in each episode is, that there isn't just one pathway to healing and recovery. But what we all share in common is this understanding of the nervous system's role and the brain's role in what we're experiencing. That's huge and pivotal, but also that support is important. And whether that looks like support from a physical perspective, or rehabilitation, or physical therapy, or whatever it might be, or self-directed neuroplasticity, or a therapist, a counselor, or all of them together, that support aspect is vital. And I think there's a lot of black and white thinking in our communities. There's the extremes, and I think either extreme is wrong. So you have some in traditional Western medicine completely rejecting all of the mind body work and the self-directed neuroplasticity, or making you feel helpless, and then putting all your power in others. And then you see the other side, the other extreme in this space, where this extreme tells us that no, we should never do any type of support, right? Just go into it all. Like, you have to figure it out. It's all up to you. You have to do all the work. And if you seek support, then you failed. Then it didn't work for you. But I've always been in this middle ground of, first of all, we all need support. And that's something we all need, we can agree on. We all need support, and support may look different to you. And I think for me, it's always been this realization, really, that I can seek support without putting all my power in that support. I can seek support while also being a partner in my healing. And I feel like that's what you guys are doing. Yes, these are all of these amazing tests that you run, and then you have this program and these therapies that you implement, but you're also inviting them to participate. There is a big onus on the individual. Like you said, you got to keep showing up.
And I mean, I'll see patients everywhere from every day to a couple times a week, once a week. It just, again, varies per case and where they're coming from. We treat patients all around the world, all around the US, even from Canada. So again, all this varies, but we're trying to expose the brain to what we're trying to teach it. So I always use the example of, like, if you only drove once a week for 10 minutes, like, you wouldn't be a very good driver, versus if you drove every day, multiple times a day, you'd be a much better driver. pick the activity in that example, however you would like. But something that I tell people is the brain's main job isn't to make you feel better. The brain's main job is to survive. That's the job. And that sucks, but it is the reality. And I always tell people, like, this is how your brain has learned to survive. Your eye movements doing this, your vestibular system doing this, your gut doing this. This is how your brain has the pressures it's been under. This is how your brain has learned to survive. We got to appreciate that. You know, it's trying its best. Now we got to help it survive differently and correctly. But when you leave my office, let's say we're doing a twice a week scenario, the moment you leave my office, you are creating neuroplasticity and you're going to default to the neuroplasticity you have built the longest. So meaning you've had a vestibular dysfunction for 8+ years. And fortunately, a lot of people are dizzy for so long.
That was me, 8 years.
I don't know why it's always the magic number of 8, but that seems to be like with 8 years. But your brain has learned to behave this way. It's not trying to. This is how it's learned to cope for 8 years. So we got 8 years of neuroplasticity to build. And it doesn't mean that this is going to take another 8 years, especially again, when you're looking at the entire individual and you're putting correct pressure on the brain to change. But that's when someone leaves and they're like, I felt good for a couple days and I started not to feel good. It's like, that's the neuroplasticity holding and the knot. And that's not uncommon through healing. That's why it's not linear. That's why it's up and down. It's your brain changing, and then it's going to revert back until we can create more solidified pathways. So there is an onus on the patient through treatment, obviously helping them as much as I absolutely can when they're in here and teaching and just even awareness of that. So when you're feeling good for a couple of days and you're not feeling good and you're like, this doesn't work. It's like you understand why this is happening to you. And you kind of understand like, oh, okay, this is just the process that's expected to happen. So there is a bit of onus there on the patient. But obviously, as a provider, we're trying to walk with them as best we can when they're with us so that they have the confidence to keep going and the confidence to continue to take this responsibility in their health and also then help them through that. So,
Wow, yeah. I love that you said, there's an expectation when your patient leaves the office that they also have to participate in this work. And how I see it is obviously consistency is vital and key. But also when you talk about these people going home and then they feel okay for a bit. And I think also when they come into your office or meeting with any support practitioner, there's a sense of safety developed in that. Right. And so their nervous system softens, their brain's alarm maybe softens and turns off. And they're like, oh, I'm supported, I'm safe. And so there's also this softening of the survival response. And then they go home and maybe it stays for a bit. And then the brain does what it's meant to do. It keeps you alive, right? The neural pathways that have been solidified are the most active and stronger temporarily until we can create these new connections. And so it's when you revert back to the old neurology, that's our prime opportunity to reinforce new connections. That's where the magic happens. And I always say your dips are opportunities to strengthen what you've learned and are learning now. And so we might feel defeated, but if you start seeing it as an opportunity for change, like your brain is primed for change in that moment. And so applying what you've learned, right? And so what does that look like for your patients? How do they support themselves? How does someone support themselves outside of the office, outside of these appointments?
again, varies per case. It's such a blanket statement. No,
Sure.
it really does. Once the things that we're doing in the office, they're doing it correctly. And obviously, people aren't intentionally doing things incorrectly, but also we want to, how nitty gritty we are getting with things is making sure that the brain is actually tolerating it correctly, that it's not going past what we call their metabolic threshold. So you're not doing this exercise and you're like feeling terrible after, or you feel wiped out after, things like that. We want to make sure that the brain is not only doing this correctly, but changing correctly and taking in the information correctly. Because if it's obviously perceiving something as a stress or a not good stress, I should say, because any rehab is a bit of a stress on the brain, we're going to have the outcome we don't want. So once it's correctly done in the office, that is something that I give someone to do at home. And something that what is pretty forward focused through CFNC is you should be able to replicate some of the things we do here so that you can take it home with you. Yes, we have technology. Yes, we have really cool tech that we use to help people. Amazing. But not everyone has the access to afford these things, which is totally fine. So I'm sure if any of my patients ever watch this, they'll tell you like about some of the basic stuff I have them do for their exercises just to maintain their progress. What I tell patients as well, and this is something that I don't change. This is where I utilize resources like yourself, like the Haven app or other things. I can't change your thoughts. I said, we can do neurological rehab all day. We can have you look at lasers and look at dots and do all this cool mumbo jumbo stuff. I can't change your thought. I really can't. The limbic system is a part of the central autonomic network. So even the way someone phrases their sentences to me, like, I'm having a terrible day, or just the way they're phrasing how they're speaking about themselves. I always tell people the brain never shuts off. This is not a knee that you've injured that you can sit and ice and you can lay off of it and it can rehab. I said, this is an organ that never shuts down. It is always on and it is listening at all times. So it does not matter if you are thinking something or you are saying something. I said, that is where my scope kind of ends. I can't change that. But like yourself with your programs and other types of resources or counselors or things like that. So if I do feel that needs to be addressed, I will obviously give them their exercises on my end to do things. From that standpoint, giving them resources like Haven or giving them other types of resources as well nutritionally. Like that is huge. And not everyone's nutrition is the same. In fact, especially with chronic illness, everyone's getting the same information of what they need to be doing. And that doesn't work for a lot of people. It doesn't work for, your size, your shape, your day-to-day activities. It doesn't work. So it's important to give someone more specific nutritional advice, hydration strategies, things like that actually fit their brain and body the best. So then we're getting all factors involved. So it's equally important to be implementing when someone walks out.
Yeah. So I love that. Again, bring it back to this holistic approach, right? There are so many factors for that to build this foundation for healing, really.
Yeah.
And, when we talk about brain retraining and the resources and support, self-directed neuroplasticity, also just being able to cultivate safety within your body. And even within my membership, we have the brain retraining, but we also have the somatic component and feeling emotions, like your emotional health. You're repressing emotion. Guess what? Your brain's going to be on alarm. Your sensations are going to get pretty loud, right? So there's so many components. And again, that is part of it, right? Teaching the brain that it is safe, sending these signals of safety, not only through your brain, but through your body, cultivating safety in a body that has felt unsafe for so long, which is, I think, also something that develops as they work with you because you're working with the body. And then there's the sense of support and safety. And again, there's more to this. There's the limiting beliefs that we hold in the programs. There's the
Necessarily, I don't get into that.
Yeah.
Brain feel unsafe, and is there biopsychosocials that are components of it, but is it the vestibular system of a brain that doesn't know where it is in space, right? That's going, and this is, again, I have these common things I share, and I tell people like your vestibular function, both peripheral and central, again, not just the inner ear. So if someone's like, my inner ear,
Yeah.
and you're still dizzy, there's something still going on. But if the brain doesn't know where you are, if you kind of think primally, if you think about, and I understand we're not like running from things day to day anymore, we're not hunting, but like the brain is a very old organ. All of our organs are, but it's old. Same with our limbic system, same with our vestibular system. It's the first special sense we develop when we are in utero. It's the very first one we do. So it is wired through our entire body. And what I tell people is, if your brain doesn't know where you are in space, if you think about it, if you're dizzy, how can you protect yourself? Right? You can't. Like, you probably could, but you are in a very vulnerable position if you can't navigate your world So the brain is automatically going to put you in a fight and flight. It's going to signal to your
Right.
autonomic. It can't shunt blood flow around correctly if it doesn't know where you are in space. Your autonomics are going to be compromised. Like all of that, your gut's going to then be affected. Your adrenals are then going to be, this
Yeah.
is where the brain takes hold, like gut, adrenals, sex hormones. This is huge.
Yeah.
All going to be affected because the brain's like, well, I don't know where I am. I need to be safe. I need to get to safety. How do I do that? And the brain, again, is just to survive. So it's going to sacrifice absolutely everything in its power to make sure that it gets enough fuel to do what it thinks it needs to do. And even if you're like, I'm just sitting on my couch and I'm dizzy, but my heart rate's
Yeah.
going up and down, or like my gut's a mess and I'm just sitting on my couch. What? That's where there's a physiological underlying to these symptoms. But then if that festers so much, we're going to get that limbic involvement. We're going to get through. And then if you're affiliating your couch with somewhere that's unsafe, we're going to get all of this happening. So that's
Yeah.
where it's a team approach.
Yeah.
Mhm.
And so even if you're looking at your clientele, your patients, do you see a commonality in some of the factors that lead to conditions such as dysautonomia, vestibular conditions, long COVID, chronic fatigue, all of those things? What do you see? Are there certain markers that are cursors to the development of things like this?
I would say a few commonalities. And for anyone listening, just because you have these doesn't mean you're destined.
Yeah.
I would say any sort of trauma. So I tell patients trauma could be physical, could be emotional, could be inflammatory trauma. So we have to understand trauma and affects the brain. It will affect the brain. Another one that we commonly see are very, for lack of a better term, high strung individuals. These people are very on all the time, very stressed, no turning it off. Like we're just always on. And so, again, usually like very high performing individuals, this could be a commonality. Now, it doesn't mean every high performing individual is going to develop these, but it's that ability to regulate and mount that response when you need it. And then we're turning it off, we're going home, we're in our happy place, we're turning off the nervous system, and then we're back on the next day when we go to work or whatever it is. I will hear a lot of, especially my female clientele, say, I was taking care of 3 kids and I was working a nurse and I'm running 12-hour shifts here and I was balancing this, and this, and I was doing this, and this, and I was working 3 jobs and I was pounding caffeine. I wasn't eating, like just everything, the way the brain was like the brain and body were impacted. And then there's symptoms there that we tend to just overlook, or we're just told it's normal. Like you're
Yeah.
after you eat, you can't sleep. Like, oh yeah, it's normal. That's fine. Just take a chill pill. You'll be fine. And, or we're crashing in the middle of the day, your cycle's not doing well, like whatever it is. And then for men, different symptoms, we just convince ourselves like, this is normal, this is common, and it's not like, this is just a part of the course. And then all of a sudden, something stops them in their tracks, whether again, a trauma comes up, something insults the brain and body. And then it's like overnight or over within a short period of time, the brain's like, a timeout, I can't do this anymore. Your body's telling you, and also again, lack of information out to typical people, like you shouldn't be fatigued in the middle of the day. You should be sleeping through the night. Your menstrual cycle is a vital sign as a female. For men, different signs, like are your vital signs, like just like heart rate and blood pressure, like all of these things are your body communicating with you, like we're not doing okay.
Mhm.
And it whispers, your brain
Yes.
is surviving, and then all of a sudden it can't survive. So we tend to blame the moment it happens and goes, it was that yoga pose that sent me over the edge. And I'm like, probably wasn't the yoga. And the brain went, time out, I can't do it. I can't do this anymore. And it stopped you in your tracks. That's
Cool.
something I commonly see again, but I also see like TBIs where life was great up until that event, and just varies per case. But when we talk about that more chronic long COVID type of scenario or chronic illness scenario where people are like, I'm not really quite sure where this came from, those are some commonalities we see.
Yeah. Yeah. Definitely typical. All the things you listed are all the things I had. Like the type A overachiever, the pressure, the intensity, the trauma upon trauma, repressed emotion, not eating well, just being a mom, and there's a lot, right? And so it's never just one thing. And I think when I first got diagnosed with all the things, I always said it was, oh, it was because I caught that parasite. It was that parasite that did it. Meanwhile, my body was talking the entire time, and it's so true. It starts off as a whisper, right? It's the fatigue, the feeling off, the fogginess, the whatever it is that comes in, the headaches that are just coming out of nowhere. More coffee, more Tylenol, more Advil, just push through and you're okay. You're not okay, but you're surviving. You're surviving, you're living, you're functioning. And then it just takes one more thing, right? The straw that broke the camel's back. And then your body says, no more. It screams, no more. We are done. And it's so sad that we have to get to that point to really start listening and supporting ourselves. And I think the reason we share what we do, a lot of us, is because we want people to not have to get to that level before they do something, right? And practice that self-care, the nervous system hygiene, the pausing, the changing things in your life that are putting you in constant states of cortisol and adrenaline.
Our world doesn't operate that way. I mean, just like nothing's really built with that in mind. And who knows how much we're able to change that reality. But I just tell people, if you become aware of it, you can start creating your spaces within it and be able to harvest that. And again, we write off these symptoms. We write them off and go, yeah, like, I'm just a mom. I'm a mom. Yeah, of course I'm tired. My kid doesn't sleep through the night. Or I must be tired because I'm chasing a kid all day, and or whatever excuse is. We're told that's okay. And so
Yeah.
and stuff just gets kind of shoved under the rug, especially in women's health. But like all these things just get shoved under the rug and we think it's normal. And again, the US and Canada's healthcare system is very different, but it's still built on a sick model. It's not prevention. For those who don't know, I'm Canadian, so part of my life was there and here, but I don't think there's a perfect model yet, but there's no model built on prevention just yet,
Yeah.
built in that world yet. And I think it's maybe changing. We'll see with more help with people like you and other healthcare providers. But I think the more patients realize when you're walking to a doctor's office, their goal is to rule out a pathology. The goal is to rule
Exactly.
out or give you a definition to your symptoms of a sickness. That's the goal. That's what they're
Yes.
trained to do. I have this conversation with patients all the time. Like, that's what I was trained to do in my chiropractic school was let's understand all the pathologies. And of
Yeah.
course, chiropractic is a little different. We are taught more prevention naturally, given our history and everything that it's built on, but we are taught to rule out or rule in pathologies. That is what, and same with physical therapists, same with most providers. So that's the letdown when a patient walks in and they get, here's your diagnosis and here's your medication, or like,
Exactly.
and that's what it's built on. That's how we're taught.
Yeah. Yeah. And then you only know, what you've been taught and what you've studied. And I think I am very hopeful because we're starting to see the changes. Like my cardiologist now is studying neurology. He's fascinated by the brain and neuroplasticity. And my neurologist refers people to the nervous system work now. And last week I had an amazing family physician here in Toronto who's changing the way that we approach traumatic brain injury and highlighting neuroplasticity. And then we have places like you that are really weaving in mind, body, but also the brain, right? And bringing in some technology, some really cool stuff that you guys do over there that I've seen on your website to really help optimize this recovery. So if I were to ask you, when you see your patients, the ones that do best, that maybe have most successful recoveries, what are some of the qualities or what makes for a successful recovery?
Mindset.
Mm,
That's one of the, and I had a patient this week. Mindset, honestly. And I get it. People are skeptical. And I always tell patients, I don't care if you ask me questions. Like, ask me questions. Like, your provider should never be threatened by you asking questions.
oh, so good. Yes.
Should never. And if they get threatened, that's to me a red flag. And I tell people, I'm always open to questions. I want you to feel comfortable in what we're doing. But there's kind of a different level of like, I have to convince you of what we're doing. And that's a
Yeah.
little different, right? And I understand we're guarded. Yeah, especially people who have been gaslit or people who have been tossed on this conveyor belt. But some of those cases do the best too. Like you just unwind all that distrust and they open up and it's amazing. But I will say out of the gate, I had a patient this week that they do everything really well on their own, but at home in the sense of doing all the stuff from a functional medicine standpoint, they're there. But just their presence of like, I'm ready to change. My brain's ready. I'm ready. This is going to be great. And even on the first visit, and I usually tell people within the first 1 or 2 visits, I can tell you how fast this is going to go. You can see changes, and if they happen fairly quickly, they may not stay, right? That's that neuroplasticity, that's that up and down we spoke about, but it's how quickly that brain takes to it. And the mindset helps significantly with that. And again, my more chronic warriors who have been through this ringer just still have that. I know I'm not feeling well. I know I have had a long road and I have a long road ahead, but I'm here to work. They have some distress, but we're just unwinding that. And then they just open up and it's amazing. They do well as well. And then I've had people who are super skeptical. I'd say they fight me the entire way and they're like, I didn't believe this was going to work. I'm like, that's fine. And they also do well. But I would say the speed of which all that happens, definitely see it faster in the individuals that holistically, they're like, hey, I'm supporting my nervous system with my food. I'm supporting my brain function with my day-to-day stuff. Fortunately, they have a good support system, just like all of those things. And I know not everyone can regulate all those factors, so it varies. Yeah. But that's one of the biggest things that I see. I always ask patients, were you an athlete or did you do well in school? And they're like, yeah, I used to have a photographic memory. I picked up things really quick. I'm like, everyone has this amazing ability for their brain to change, but it's interesting. The individuals that change differently, like you can see it in their rehab here. It's quite unique.
Interesting. So actually, I'm curious, the ones who do really well in school and who are really brilliant, does their brain fight harder?
Depends on how long, I would say, like that's the caveat with athletes. So, they usually like the first session, they're like, wow, my heart rate dropped 20 points with this. That was awesome. Like, I feel great. And I'm like, okay, your brain learns fast, but that means it learns the incorrect things fast as well.
Exactly.
The likelihood of probably giving them to do things quicker as soon as it can is better and then more frequent. Like, even like, I'm like, you got to do this 5 times a day. Like, we got to do this a lot more because their brain's going to unlearn it a lot faster versus the patients that are like, yeah, I didn't learn very quickly, but once I got it, I got it. And those are cases that may take a little longer. And again, this is not science. This is more anecdotal. This is more just observation. But those might take a little longer in like the initial phases. But then like they do really well. I'm not seeing them much anymore. I love hanging with you, but I really don't ever want to see you.
Yeah. So when we talk about mindset too, because maybe elaborate a little bit on that. So what does that kind of look like? The people I work with are really shut down. They have zero hope, right? Zero, maybe 1% belief in that things might change for them. And these are typically the people who've been in it for a very long time. We're talking 10 years, 5, 10, 20 years even. And they're coming in and their mindset is really negative, right? There's victim mentality. There is almost like this identity of illness. I am my illness. This is who I am. I guess from your perspective, do you see that changing and evolving? And what do they end up doing to support that?
With everything we do, we have objectives, right? And what that means is the subjective is what the patient is telling us. The objective is what the doctor is seeing on an examination or through the diagnostic process. And so when we have these objectives and benchmarks, and I go through that with patients like, hey, these are the metrics. You have a nystagmus, blah, 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 whatever it is, like these are our benchmarks. And I always tell people, I'm going to see this change faster than you're going to feel them. Like probably 90% of the time that happens. We may not feel this big difference, but these are changing. And once they start changing, then symptoms then come aboard. So when I actually show someone, and I had someone who has been dizzy for almost 8 to 10 years, again, this magic number. And they're like, no one can tell me why I'm dizzy. And, again, that guarded, skeptic, everything, and that's totally fine. And I remember they called me on the phone, and I'm just helping them get scheduled. And they said, like, no one can tell me why I'm dizzy. And I was like, we'll be able to tell you. So they came in, we did our tests, and I literally pointed on the screen and said, this is why you're dizzy. And I said, and then this next test, remember when we did, this is why this rehab for you did not work in the past. Because look at how your brain's responding to it. So you can give that objective measure and say, listen, we got to change that. If we can't, there's something blocking that. We got to figure that out. That's a whole other kind of kettle of fish, but we got to change that. So I'm going to be looking to change that along with the other benchmarks. So when they actually see that change, that's where I find that gets dismantled or that gets brought down. The walls come down and they're like, okay.
So they have this measure, almost this reflection of, hey, something's changing. And so then the belief builds, right, slightly. And then what about those people who, let's say they come to you and they're in that an intensive, right, a week or so, and then they're on their own. And so there's no measurements.
Depending on what's going on, I just used that person's example, but it just kind of depends. But during the week, like I'm reevaluating. If we're doing autonomic retraining, you can see someone's heart rate change in real time. It may not, again, stay that way, but you can see a change. So
Yes.
I see what I love about what we do is like you could see your neuroplasticity changing in real time with what we're doing. So again, you can kind of go, oh, look, my body's changing. Oh, this is really cool.
Yes. But that's when they're with you. What about when they leave? Say they traveled there from Canada and they do that intensive, right? And so you've built their belief and then they go home and then
Homework.
they have homework. But how do they keep the mindset if they don't see the results? I think that this is probably one of the biggest challenges for people who are doing kind of something self-directed. And is there something that you maybe would advise them or how to encourage them in that way? When you're meeting with your client or you hear from them and it's been maybe a couple months and they've got their homework, but we don't know if they're doing it or not.
The first thing is I don't let a couple months go by. That really happens. I've ran into that, especially in the functional world.
Yeah. Yeah.
People supplements and they're like, call you in 3 months. And I'm like,
Yeah. Yeah.
so we are very much involved. Like, so if someone leaves my office from an intensive, I'm talking to them. I would say the very, very, very max that I'm comfortable with is about 4 weeks. That is max. It's usually about 10 to 14 days because I want to understand what barriers are you facing? What are you facing from doing your exercises, if any? Also, through the 5 days, we're talking about that. What does your day look like? When do you pick up the kids? What do you eat? When do you we're spending like 4 to 6 hours a day just hammering it out while we're doing our rehab, going, okay, so if this happens, I want you to do this. If this happens, I want you to do this. So by Friday, they're annoyed by my voice. They really are like, Doctor, please be quiet. I can't stand you right now. I always make sure that people feel comfortable and confident in what I'm asking them to do, and it's manageable. People are fed 100 different supplements. They're fed all these exercises to do. Yeah. I don't know about you, but when I go to PT and they give me more than 3, I'm like, I'm not doing this. I can't. I'm not doing it. I'm looking at a person. I'm looking at someone who's not just a body and a set of eyeballs and a brain, and they are a human and what that feels like to me. But I make sure on that Friday when they leave that they are comfortable and confident in what they're doing. We're going to check in within 2 weeks. And again, probably following up with them virtually, again, every 2 to 4 weeks for a little bit of time to really ensure that they are doing what they need to. I've had some intensives come back, just kind of depends on the case, or we try to establish them with someone who does similar work to us back home.
Yeah.
Do they have a therapist? Can we run point with them? Obviously, they're not doing the neuro rehab, but, hey, I'm suggesting, hey, I'm suggesting DNRS. I'm recommending these. Who can they report to more frequently? Who's on the ground with them? So I try to make sure that we're setting up their network when they go home efficiently so that their mindset remains or just it continues to improve. I think I've only had one autonomic case to this day that came symptomatic on Monday and left asymptomatic on Friday, and they remain. Like, and they remain.
Yeah.
Hundreds of patients I've seen. So I said that is the exception to the rule. How it works is, yes, you'll feel a bit of a difference by Friday, but you will continue to improve if you put in the work when you leave. Even up to a year later, I've seen patients a year after their intensive, and they're like, I'm doing more, I'm getting better, and they're doing different things. So it varies per case, but making sure that they have a firm network of people, and that healing is not linear, but healing also takes a team, because
It does. Here we go.
the
Yeah.
medical system works in silos. We got to remember that, like, you go to a cardiology to go look at the heart, you go to a neurologist to look at the brain, you go to the endocrine to look, and that's okay. We need those specialists to really dive in there, but then we need everyone. It's a team. We need to have this team and try to communicate it. So you need a good quarterback. Well, I'm trying to say.
Yeah. So bringing it back to kind of that idea of support, like you're not meant to do this alone.
Nope.
And I think that keeps us motivated because there's a lot who start strong and they lose motivation. That's why you need that connection, or even having a connection to a community, or, like you described, the different resources, whether it's a therapist or a community. I have so many members in Haven that we motivate each other and we keep each other accountable. And so there needs to kind of be that.
Sometimes you need to not feel like a patient for a while. You know what I mean?
Well,
Like,
or
sometimes I've ran into that a lot. They're just burned out. They're just like,
yeah.
I'm sick and tired of feeling like a patient. I'm like, I don't blame you.
Yeah. So true.
Yeah, just take a
Yeah.
break. Ideally not super long. You want to keep that progress going, but and also I tell people, like, it's okay to say no to your provider.
Yeah.
This is a big one. Like, your provider is here to serve you. I tell patients all the time, I'm like, I'm here to help you. You can say, that's not going to work for me. I tell them all the time,
Yeah.
work for you? Like, and if they say no, I'm like, okay, let's figure it out. Let's pivot. So don't be afraid to tell your provider, like, hey, I can't do these 12 exercises for 24 hours a day. Like, please help me figure this out. Don't be afraid.
Yeah. So again, a team, right? You're working together. And for those kind of listening right now, maybe someone who's needing like a hope rope, right? So someone who's really struggling, who's not well, maybe even someone who just, maybe doesn't even have the capacity to come see you, or even, just not able to start anything yet, but they want some hope. What would you say to someone who's really struggling and they think that their case is unique, that they're never going to heal, that they're too far gone, too broken, that their brain is damaged, or whatever it might be? What would you say to them?
I just actually heard this a couple weeks ago, and there is no ceiling to healing.
Oh,
There's no ceiling to it. There's no glass ceiling. There is not. Even if someone is asymptomatic, and for the most part, like, health isn't a destination. I know that is the corniest thing we all see on, whatever we look at, but like, it really isn't. And we're taught that, oh, once you're healthy, you are healthy. But actually, it's maintenance. It is a level of maintenance. Like, we hopefully brush our teeth every day, and we take a shower
yes.
every day. Like, those are hygiene maintenance that help so much with our health, right? It's things that we do every day to help maintain and continue our health. So there's no ceiling to it. And that means, and it's definitely this marathon. There's moments when we can speed up there's moments where we have to take a walking break, some moments where we have to take a drink of water and stop. But we should be continuing that. You got breath in your lungs. If you believe in a higher power, if you believe in God, if you believe that, then you are still on this earth for a reason. Like, if you got breath in your lungs, you have to be here, and you are a valued being. You are an amazing person. Even if you're not here, you're still an amazing person. But like, you are here to continue to move in the right direction. And so even if that's like small things every day, manageable things, like, just keep going in that direction.
Amen. I love that. I believe it too. I think like you have the breath of life in your lungs and God's going to use you. And maybe you don't know what that is yet. And it's not your job to figure it out. He'll direct your steps. And I love that. That's so powerful. And I'm going to start using that. There's no ceiling to healing. And I think some people, when they hear that, the healing's never done. And they're like, but why? I'm like, it's a good thing. It's a great thing, because when I first started, I just had this one goal in mind. I don't want to be dizzy anymore. I don't want to have pain anymore. And like, that was for me what healing meant. And then I reached that. And then I just kept evolving, kept expanding, kept transforming in ways I never thought possible, and increasing my capacity for things I never even knew, right? Or never even thought of or entertained. So the healing will happen until your final breath. And that's a good thing. right? And we can't put healing in a box. We cannot put a ceiling on healing. And there's so much hope. So don't put that limitation on yourself. Bianca, this was so, so helpful. I think it's going to bring hope to so many. How do they get in contact with you? I think we'll put that in the comments as well, but if you wanted to share.
Yeah. So, like you mentioned, I am a part of Carolina Functional Neurology Centre. So we currently have 4 locations. We started in North Carolina, so we have a location in Raleigh, North Carolina, Charlotte, North Carolina. We do have a location in New England, and then I just opened up our Florida office this year. So we're between Tampa and Sarasota. So we have patients fly in from different countries and different states to see us. So there's a variety of options that are available. We do have something called the virtual lab. So we do try to put out some virtual content for people to learn, feel empowered, or just give more tools to them to use. So we have the virtual lab as well. So to get in contact with us, obviously you can go to our website. We do have 3 Instagram accounts. So Carolina Functional Neurology Center. We are the doctors behind dysautonomia doctors. And then we have the virtual labs presence as well. And like all the things you see there is the doctors generating that, like all the information that's there. I've written or other doctors have written blog posts, case studies, things like that. And so please feel free to reach out to us at any platform. We have people who, like our team's always trying to answer people's questions, and we do consultations and things like that. You can find us through those platforms.
Awesome. So I will add all of that in so you have the information below. And again, I want to thank you so much, Bianca.
Thank
It
you.
was such a pleasure.
No, thank you so much.